We're now joined by Dr. Jessica Israel, who is Senior Vice President of Geriatrics and Palliative Care at RWJBarnabas Health. Doctor, good to have you with us.
Thanks for having me. Excited to be here.
Let me ask you this. In your view, geriatrics and palliative care, first of all, could you define palliative care and how is it different from hospice?
So that's a great question, and one that a lot of people ask. I'm going to start with the definition that I came to New Jersey with when I left New York. I was early into palliative care, and a mentor of mine said, when you come to Jersey, how are you going to explain to people what palliative care is? And she told me to say, it's good medical care for patients with serious medical illness. And that's the way that I think about it. But essentially, it is for patients with serious medical illness. It is impeccable early recognition and careful treatment of symptoms, as well as expert communication about goals of care and medical decision-making. And it looks at not just the physical sense, but someone's spiritual sense of well-being, their emotional sense of well-being, the world outside them, their families, people that they love, and how a serious medical illness fits in or doesn't fit in with all that.
Palliative care has changed in one way, a very significant way. It's changed in the face of COVID is?
Well, I would say that the difference is executives at hospitals understand what palliative care is all about now, and so do patients, because very, very quickly, this field and the expertise got pushed to the forefront. We really needed expert communication, especially, and expert symptom management early in the surge of the disease and now, especially when patients and families are separated because of visitor restrictions. There needs to be someone who can communicate exactly what's happening and talk about goals of care with families and patients, and in this case, across significant borders.
Doctor, you know, the whole idea of geriatrics, you know, and I know this because my dad was sick for a very long time, treated by folks at your place, and then died passed in the fall of 2020 after a long illness. And so we're very connected to not just geriatrics, but, you know, palliative care and hospice as well. But the reason I'm raising this is that it seems to me with COVID disproportionately affecting older people, that palliative care becomes even more important than ever before, correct?
I think it's such a great point, Steve. I'm glad you brought it up. I think in the beginning of palliative care, and in some cases this even happens in hospitals now, the crisis of hospitalization brings up the need for this kind of communication. But really, patients are much better served if we can take the communication part out of a crisis and move it upstream. Everyone with a serious medical illness has an opportunity to talk about their goals of care before moments of pressure. And in many cases, this prevents moments of pressure. So especially the communication piece belongs way upstream of an emergency.
What is, in fact, the Palliative Care Collaborative? What is it exactly?
So that's something particular to RWJBarnabas Health. So the Palliative Care Collaborative is our systems approach to bringing together the teams across our 12 different hospitals. So palliative care teams can range in size. Sometimes it's one or two professionals, maybe a nurse practitioner or a physician, and sometimes it's a team of 6 to 8 people, including social work support and different paraprofessionals. So the Palliative Care Collaborative in the system is the leaders in palliative care on these teams coming together on a regular basis to learn from each other, and I would say even more importantly, to support each other. It's a tough thing to face serious medical illness every day. And sometimes people need mentorship and support. And when teams are small, that's hard to find at your home site. So this sort of extends that network to really make us all practice better, something I'm really proud of. And during the pandemic, it was the Palliative Care Collaborative that really very, very quickly put together 24/7 access for every provider in our system to palliative care. Through a telephone hotline, we made phone calls to families at home on behalf of the physicians because of the workload to help along the way. We've written standardized order sets so that we can teach through the way that we recommend physicians and providers prescribe. So super proud of our effort in that.
Final question. Support for caregivers critically important, correct?
I think it is one of the most important things we can think about. You know, in palliative care, we think a lot about emotional support for providers who work in different spaces. But I would say even in that field, it's the kind of thing we talk about at the end of a meeting, or it's the last hour of a weekend thing, but something that I really think we need to move forward. And the pandemic has taught us a lot about that. Being in these spaces is difficult, and physicians in particular are not really great at talking about that difficulty. And sometimes you have to push it for that to come out a little bit.
Important work, Dr. Jessica Israel, Senior Vice President of Geriatrics and Palliative Care at RWJBarnabas Health. And they are, in fact, a significant supporter of public broadcasting and the work we do. Doctor, thank you so much.
Thank you so much for having me.
You got it. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Turrell Fund, supporting Reimagine Childcare, the Healthcare Foundation of New Jersey, PNC, Grow Up Great, the New Jersey Economic Development Authority, Summit Health, United Airlines, the New Jersey Education Association, NJM Insurance Group, and by Choose New Jersey. Promotional support provided by New Jersey Family Magazine and by bestofnj.com.
I'm Tim Sullivan, CEO of the New Jersey Economic Development Authority. Since joining the NJEDA, I've been struck by the incredible assets and resources that New Jersey has to offer. The NJEDA is working every day to grow New Jersey's economy in a way that maximizes the values of those assets to benefit every single New Jersey resident. This includes more support for small businesses and a focus on reclaiming New Jersey's position as a leader in the innovation economy. Visit njeda.com to learn more about how NJEDA is building a stronger and fairer New Jersey economy.